We are going to be doing the full Webster technique on her pelvis. Piriformis sweep. Stretch out a little extra more. The sacrotuberous ligament. Gentle little mobilization of the pubic bone. See if one side is shorter in comparison to the other one. And I'm going to push into that hip flexor and help open it up. Gentle stretch on the round ligament. We are doing chiropractic. We're doing the Webster technique, but acupuncture, blocks, and doing the spinning babies are always highly recommended. So we have mom here who was just diagnosed with baby being BREECH. Right now we're trying to figure out if baby's transverse, so baby being here or baby butt down and head up. We are going to be doing the full Webster technique on her to encourage baby to have more space available for her to move into that head down position and start to put pressure on her cervix. Here I'm just relaxing her shoulders with using the hypervolt before I start to do her adjustment. And so first I'll be adjusting her SI joint using a drop technique. She is on pregnancy pillows on her pelvis. Perfect. And then we're going to do a piriformis sweep. You okay here? Mm-hmm. Good. Find a spot in her piriformis to help stretch out a little extra more.
Right. Yeah.
And Dr. Larry Webster, chiropractor, figured out this technique by implementing it on our daughter, who was pregnant at the time, and he found that she got a lot of relief when it came to giving birth and also encouraging that pelvis to open up a little bit more and make more room for those babies to turn into that head down position. That was a piriformis sweep, and then we're going to be checking the sacrotuberous ligament. Mama, go ahead and cough for me. Perfect. One more time. So the sacrotuberous ligament, it's in a small component where we're able to release that tension, again, to create better movement of the sacrum. And here, just checking the tension, the dural tension between her occipitals and all the way down to that sacrotuberous ligament. Perfect. All right. And here, this is just a gentle little mobilization of the pubic bone in order for us to start spreading to make room for that baby. It actually feels really good.
Okay.
Yeah. Does not feel like it's like stuck or anything, which is good. Hands above, reach. We're gonna check her hip flexors. We're checking to see if one side is shorter in comparison to the other one, and she's showing slight shortness into her right side. So I'm gonna bend her knee, take a breath in for me, Mama, and I'm gonna push into that hip flexor and help open it up. Breath, all the way out, good, breath, all the way out. And all of these movements are completely safe and away from baby. Does it feel like I'm crushing you at all?
No.
Okay, perfect. Yes, and then all the way down. Good, breath, all the way out. Good. All right, let's remeasure you. And we are nice and even. All right, last component to the full Webster technique is the round ligaments. The round ligaments can stretch up to almost 10 inches depending on the growth of the baby. And we think of those as like tight bands around the uterus. And so we want to make sure that they're nice and loose. Does one side feel more tight than the other?
I can't tell until you start palpating.
Yeah, so you start working on it. I'm gonna work on both of them today.
Okay.
To have that extra precaution. And so this is just a gentle stretch on the round ligament. I'm not going more than an inch up, and then just to help stretch those out. Sometimes moms will feel sharp shooting pains through there with sudden movements, coughing or sneezing. And so we just want to make sure that they're nice and loose on both sides. Good. And check the other side.
Both sides feel a little tight.
Right? Yeah, that's why I'm just gonna work on both of them. Well, with mom too, I recommended her to do acupuncture and do all the necessary things to encourage baby to move. Again, we are doing chiropractor, we're doing the Webster technique, but acupuncture, moxa, and doing the spinning babies are always highly recommended for moms to follow up at home. Now we're gonna adjust her neck. Big breath, mama. Another one. All the way out. Perfect. One more. Let it go. That's a good one. Let it go. Ooh, that was a nice one. Last one's to help open up the shoulders right in through here. Big hug. I'm gonna roll you over towards me, take a breath, let it all go. Oh yeah, that was lovely too. You are well adjusted, mama. And show me how you properly will get up. Good, shift, beautiful.